Hello, and welcome to our presentation. Today, we'll see how our advanced electronic health record system is changing healthcare management and helping doctors provide outstanding patient care. Softbeer is a medical software company specializing in modular-based EHR and eMAR customizations. ApkaMD, our EHR system, is designed with modularity, allowing us to enable or disable specific modules as needed. This flexibility enables us to choose from various functionalities, such as RPM, DSMT, Telehealth, insurance discovery, and insurance verification, based on the specific requirements of healthcare providers and their patients. We offer diabetic self-management training through our integrated sister company, ApkaMD Pharmacy Services. Remote patient monitoring is also available as an add-on directly into the EHR to improve continuity of care. We also offer eMAR, electronic medication administration recording, which offers convenient ordering and reordering of medications for patients in an inpatient care setting. Our EHR and eMAR are ONC certified and certified by HIT. When integrating with other systems, all connections are HL7FHIR endpoints, and our servers and data are cloud-based and hosted on AWS. To start us off, this is an example of a patient's journey through our system. Gina has diabetes and hypertension, and she's experiencing new symptoms. Our system can pull prescription history, medication adherence, drug-to-drug interactions, and possible chronic conditions with minimal information, such as Gina's name, date of birth, gender, and zip code. Using this information, her healthcare providers will be able to create a personalized health plan for Gina and schedule a telehealth encounter for her if needed. Our sister company, ApkaMD Pharmacy Services, can supply 30 days of medications packaged in daily packets with the date and time of when to take those medications. We also send Gina text reminders when to take her medication. We can also offer remote patient monitoring services for Gina. Gina and her care team can use smart devices to monitor her blood glucose and blood pressure levels, as well as trigger alerts during periods of abnormality. If Gina needs to be referred to another physician or specialist, her care team can forward her medical history to them and coordinate a telehealth encounter for Gina. By leveraging the services provided to them in ApkaMD, Gina's healthcare providers can help her manage her conditions and achieve her goals. Our APIs allow for seamless integration into various systems and facilities, such as laboratories, pharmacies, and billing systems. By leveraging these APIs, organizations can streamline their processes, improve efficiency, and deliver exceptional services to their clients while maintaining a high level of accuracy and reliability. Our telehealth module provides face-to-face interactions with patients directly from ApkaMD. No special software is required for either party to join. Links are sent out via email or text. This user-friendly approach ensures a seamless and accessible experience, fostering better communication and personalized healthcare delivery from the comfort of patients' homes or any remote location. In this module, we'll demonstrate the intake process for a new patient by jumping into the software and showing how it works. A front desk representative at a clinic using ApkaMD would have access to the patient list, intake forms, the scheduler, and their appointments, and they would have the ability to add new patients to ApkaMD. Let's start by looking at the scheduler tile. In the scheduler tile, users can view a calendar of appointments labeled by the nature of visit, such as physical exams, consultations, follow-up appointments, urgent care, and more. These labels and color codes are customizable by the user to integrate seamlessly into any workflow. In the Appointments view, a user can track various key aspects of each appointment, check confirmation status, the patient's current location, and whether there have been any appointment cancellations. These appointments can be filtered by the doctor assigned to them, allowing the user to see the schedules of all doctors or drill down to a specific doctor. A patient with a confirmed appointment will be marked as such, allowing a user to click through it to get more information about the visit. A patient that hasn't yet confirmed their appointment and is not currently in the lobby will not be clickable, to avoid clerical errors. Lastly, we'll quickly demonstrate the patient registration process for a nurse or front desk representative. For this next part of the module, we'll demonstrate a comprehensive medical visit by taking a look at an encounter through the perspective of a nurse rendering the encounter. We'll start by logging into ApkaMD as a nurse and opening the confirmed appointment for John Fiction. Here, a nurse will be able to record data from the patient intake process. They will be able to record things such as vital signs, weight, temperature, pulse, history of present illness, and anything else that the patient verbally says that they're at the doctor's office for. They'll also have access to a separate tab to record the patient's history of present illness. From the Medications tab, a nurse would be able to record any current medications a patient is on, view the facility's current supply of their medications, and record the quantity of medication that the patient currently has. In this tab, a nurse would be able to record a patient's food and medication allergies. In the final tab, a nurse has access to an assessment for depression and falling risk for a patient. If a nurse needs to administer vaccinations, they may do so from the Immunization tab. By clicking on Add Immunization, they can document the vaccination such as the administration site, dosage, and administered date. In this module, we'll demonstrate the process that a doctor would document information collected from an encounter with a patient. Let's start by logging in as a doctor. From this view, a doctor can see patients that are waiting in the queue, encounters to complete, and their completed encounters. We'll take a look at our encounters to complete and check in with our old friend John Fiction. After a doctor selects a patient, they can tap the Begin Encounter button to start documenting time spent consulting the patient and reviewing their information. To the left of that button, the doctor will find the Communications tool, which allows a doctor to call or text a patient directly through ApkaMD. Next to the patient's profile picture, the doctor will find the button to begin a telehealth encounter. As said before, the patient or doctor will not need to install any software to engage in a telehealth encounter. Each of them only need a device with a camera. The doctor can use this drop-down to select the chief complaint for the appointment. Under the Subjective section of the Encounters tab, a doctor can record information relayed by the patient. As before, this window is completely modular and can be adjusted to fit the needs of the practice. Under the Objective section of the Encounter tab, the physical exam allows doctors to record objective measurements observed during the encounter. Family history is where hereditary diseases of relatives can be recorded. Just like before, this window is highly flexible and can be easily customized to suit the practice's specific requirements. Social history is where conditional data such as retirement status, living conditions, and substance use can be recorded. Medication reconciliation is where a doctor will find the patient's current medications, as well as the pharmacy that filled their medications and the original prescriber. ICD-10 codes can be searched by diagnosis. There's no need to memorize codes for specific diagnoses. By clicking View Assessment, a doctor can look at the assessment associated with that diagnosis. The same is true for the care plan. Each one of these options is drillable into its own portion of the care plan. And at the bottom of the encounter form, a doctor can schedule a follow-up examination, which will be sent to the front desk to be relayed when the patient is discharged. Moving on to the RX History tab, a doctor can see Mr. Fiction's past prescribed medications. Doctors can see the prescribed drug, the assigned directions, the quantity prescribed, the day's supply, the fill date, the pharmacy that completed the order, and the healthcare provider that prescribed the drug. This data is sourced from 3 major health information exchanges, giving the doctor nationwide coverage of pharmacies and prescribers. Under the Adherence tab, doctors will be able to determine if a patient is taking their medication as prescribed. If a patient has a 30-day supply of ibuprofen and it took the pharmacy 35 days to refill the prescription, a doctor can determine that the patient was without medication for 5 days. Those 5 days will be represented by a red square. Under the Chronic Conditions tab, doctors will have access to educational materials that can be referred to and sent to the patient. ApkaMD comes equipped with a wide variety of articles and educational materials to help patients manage their conditions and make more informed decisions. These materials will be sent via email by default, but can be sent through SMS as well. To wrap up this module, a doctor also has access to immunizations administered if they need to administer a vaccine. This window is the same window that the nurse had access to in the earlier module. This slide will go over our e-prescription feature, which equips doctors to transmit prescriptions directly to the pharmacy, eliminating the need for traditional paper prescriptions. With this e-prescription system, doctors gain the ability to choose a specific pharmacy where patients can collect their medications. By accessing the patient's medical history and allergy information, the system can also provide alerts to avoid prescribing drugs that the patient is allergic to, while suggesting suitable alternative medications for the best possible treatment outcome. Moreover, the system offers a crucial safety feature by allowing doctors to check for any potential adverse reactions that might occur when combining multiple medications. This streamlined approach not only enhances patient safety but also improves the overall efficiency and accuracy of the prescription process. In the context of electronic health records, case management entails a well-coordinated and systematic approach to handling a patient's healthcare journey. It involves organizing and managing various aspects of their care, such as appointments, medical records, treatment plans, and communication between healthcare providers. Our goal is to ensure seamless collaboration, enhance patient outcomes, and optimize healthcare delivery through efficient information sharing and decision-making. Let's jump back into ApkaMD and show off what our system is capable of. For this demo, we'll be looking at another one of our test patients, Sandra Mucho. Through the case management module, doctors will have access to diagnostic labs, radiology imaging, genetic testing, and so on. Doctors will be able to search for providers of each of these services by the name of the facility or by distance from a designated zip code. In this example, we'll search for a lab near the patient's zip code. After a facility is selected, doctors will be able to select what their order will be, select the priority of the order, and provide notes as needed. Like before, doctors will have access to the diagnosis search function, eliminating the need for memorizing CPT codes. They will also be able to note whether samples have been or need to be collected for the order, as well as schedule the order for a future date. To finish off the order, doctors will be able to select who gets billed for the order. After the order is validated, all relevant data will be autofilled by ApkaMD and will be ready to sign and send off. We'll demonstrate this process again for putting in an order for a CT brain scan. Doctors will be able to select the contrast required for the scan, whether it requires 3D reconstruction, and the priority for the order. As before, they will be able to search for facilities through vendor name and zip code. Next, we'll demonstrate the process of referring a patient to another doctor or practice. Like the search function before, doctors will be able to filter results by name, specialty, and distance from a specified zip code. Fax numbers for doctors will be autofilled by ApkaMD, but SMS and email are available as well. As before, there's no need for doctors to memorize CPT codes. ApkaMD has them covered. A boilerplate message will also be generated. Next, we'll go over every data set tracked in the case management module. Brief definitions will be provided for each category. Labs and imaging is where test results and medical images like X-rays are stored. Documents is where medical files and reports are kept for easy access and sharing. Progress notes is where short updates from doctors about how a patient is doing during their treatment are stored. History and physical provides detailed info about a patient's medical history and checkup findings from their first visit. Chart updates is where any new info to a patient's electronic chart is collected. ADT events are notices about a patient's admission, discharge, and transfer events. Insurance provides information about a patient's insurance coverage and billing. Diagnoses shows the patient's past and present diagnoses. Medications shows the patient's past and current prescriptions. Allergies provides records of any reactions a patient has to food, medication, and so on. Immunizations records vaccines a patient has received. Vital signs shows metrics over time for things like BP and heart rate, while procedures details medical treatments and surgeries the patient has undergone. Family history shows info about congenital conditions, while social history shows info about the patient's habits. Encounters provides a record of all patient-doctor visits and appointments. The plan of care shows a personalized plan for a patient's treatment and healthcare. MedEquipment provides info about any medical devices a patient uses. Functional status tracks how well a patient can do daily activities, and Advanced Directives provides documentation for a patient's will, power of attorney, and so on. Lastly, Miscellaneous covers any other important info not covered in the above categories for a patient's care. As you can see, ApkaMD's case management toolkit is fully equipped to handle any patient's healthcare journey involving tracking, organizing, and managing all aspects of their care, from appointments and medical records to treatment plans and communication between healthcare providers. ApkaMD offers seamless integration with multiple billing systems, including Advanced MT, Health Nautica, and CollabMD. This integration allows for efficient and accurate billing processes, streamlining the financial aspects of healthcare services. In addition to the existing integrations, our platform boasts versatile APIs, which enable us to establish connections with various other billing companies and clearinghouses. By automating the report generation process, healthcare providers can save significant time and effort that would otherwise be spent on manual data retrieval and compilation. This efficiency not only improves the accuracy and completeness of patient records, but also allows clinicians to make well-informed decisions promptly. To demonstrate our report generation tools, we'll show off a patient medical record that was generated using ApkaMD's default settings. This is an example of a patient's medical records. Most data sets that are tracked by default have already been covered in this presentation, so feel free to sit back and see what's offered. ApkaMD comes equipped with several different generatable reports for the purpose of tracking different data sets. These range from generalized data sets such as demographics and admissions to more specialized ones for order management, inventory, encounters, and prescription purposes. We also offer a variety of dashboards for tracking these data sets, which again range from generalized to specialized. Our FlexForm functionality provides doctors with a powerful toolset to create their own data sets and forms, which they can customize to improve their workflow and patient care. We'll jump back into the software and see how it works. Doctors can design questionnaires for patients to fill out, covering various medical concerns, and even create their own scoring systems to assess patient responses effectively. This flexibility streamlines data collection, promotes patient-centered care, and enables doctors to tailor medical assessments for more personalized and effective treatments. This is an example of a questionnaire for a clinical opiate withdrawal scale. Doctors will be able to assess a patient's degree of withdrawal using their own questions and scoring system. This process can be as personalized or as generalized as the doctor sees fit. Much like websites such as Facebook and Salesforce, ApkaMD allows new users to register for their own accounts on the platform. Patients can use ApkaMD to fill out basic information such as demographic info and past medical history to reduce time spent collecting that information during their first visit to your practice. Let's take a quick look at the registration process for a new patient. A new patient can register an account in ApkaMD by clicking on Register here. The patient will be able to fill out basic demographic information, such as their name, date of birth, and contact details, so that they won't have to repeat that information on their first visit to your practice. This page is for filling out more demographic information, but note the terms and conditions below. All of these waivers and consent forms can be swapped out with documents of your choosing. The third page is for collecting medical history data from the patient, again for the purpose of streamlining their first visit to your practice. As mentioned before, this page can be fine-tuned to suit your practice's needs. On the final page, patients can request an appointment directly through this form. Patients will be able to select the time and date they would like to have their appointment, and the practice can set their own schedules to allow or reject times and dates. Each instance of ApkaMD's registration form is fully customizable based on the wants and needs of the practice. ApkaMD also offers remote patient monitoring services for patients and practices who wish to enroll in these services. Now RPM offers patients a variety of smart devices to track physiological data, such as heart rate, BMI, blood glucose, and more to help bridge the gap between doctors' visits. A standard Now RPM kit includes the Samsung tablet, smartwatch, smart scale, pulse oximeter, and blood glucose meter for patients to monitor their own physiological data and keep a record of variations over time. This is an example of what a patient's heart rate readings over 30 days would look like. Patients do not need to have their own internet services to use Now RPM, as 4G service is paid for by SoftBeer. Now RPM enables healthcare providers to monitor and manage patients' health conditions remotely, facilitating timely interventions, reducing hospital admissions, and improving overall patient outcomes. As part of the DSMT program, ApkaMD has a database of educational materials that can be sent to patients. Through education and support, DSMT helps patients understand how to manage their blood glucose levels, adopt healthy lifestyle habits, and make informed decisions regarding their diet, medication, and physical activity. Let's take a look at a segment of a video educating a patient on the purpose of glucose meters.
Glucose meters. Glucose meters test and record how much sugar, called glucose, is in your blood. They help you track your blood sugar levels at different times during day and night. Meters can help you know how well your diabetes medicines are working. They can also help you learn how the food you eat and your physical activity can change your blood sugar level. The 3 things you will need with your meter: a lancet, a needle that is used to get a drop of blood from your finger or another part of your body. Test strips. The strip is where you put the blood that you're testing. Control solutions. The liquid used to make sure your meter is working properly.
This is just one of thousands of videos that can be sent to a patient enrolled in DSMT services, covering just about any facet of diabetic healthcare education that can be imagined. The value of DSMT lies in empowering individuals with diabetes to take charge of their health through education and support, leading to better self-management, improved outcomes, and a higher quality of life. eMAR streamlines the entire medication lifecycle, saving time and money while enhancing med-pass quality. It offers customizable reminders and simplified chart notes for efficient recording of vitals, ADLs, and behaviors. The platform provides customizable alerts for PRN follow-ups, dressing changes, patient repositioning, and family visits. Integrated telehealth is quick and simple, requiring no installation. The cloud-based dashboard offers comprehensive medication administration insights with robust reporting options. eMAR's adaptive design ensures seamless use on mobile devices, allowing more time for patient care and less administrative burden. In conclusion, our system offers a powerful and efficient solution for retrieving medical history and identifying potential chronic diseases with minimal input. Our comprehensive patient education and after-visit summaries ensure that patients are well-informed and engaged in their healthcare journey. Our charting functionality enhances productivity, streamlining the documentation process for healthcare providers. With built-in telehealth capabilities, we enable seamless virtual consultations, enhancing accessibility and convenience for both patients and providers. Now RPM further extends our system's capabilities, allowing for continuous and proactive care management. Moreover, our agile module approach to customization ensures that healthcare organizations can tailor the system to meet their specific needs, fostering a personalized experience for patients and providers alike. For practices seeking to establish their brand presence, our white label opportunities offer a unique avenue for branding the system as their own, creating a cohesive and consistent patient experience. Our all-in-one platform brings together innovative features, advanced technology, and user-friendly design to revolutionize healthcare delivery. With our system, healthcare providers can elevate patient care, drive better health outcomes, and thrive in a dynamic and evolving healthcare landscape. Thank you for your time and consideration, and we at Soft Beer look forward to partnering with you on your journey to exceptional healthcare provision.